And we're really all here for the same reason. We know we need to fix Michigan, and we know that in order to do that, we need to bring jobs back. That's the #1 issue. I think there'd be, general agreement here. If people are going to buy houses and we're going to build houses, we need people to be working in jobs. And we've lost 1 million jobs. At the beginning of the decade, we had 5 million people working in Michigan. Now we have 4 million. We've lost 1 million. We had 1.5 million on state aid. Now we have 3 million on state aid. 4 million working, 3 million on state aid. And I think that explains, our difficulty. And being a physician it's very a timely background to have, because the health care expenses within our budget link to our economy. They link to our ability or inability to bring jobs here. If I asked you, what we needed to do to bring jobs, I know what you tell me. You'd say tax cuts, for businesses. Some might say investing more in education. Some would say fixing the roads, keeping our streets safe. Those infrastructure things that government should be doing. But we're not doing them. And why is that? If you look at our state budget, you would see the single biggest piece now is healthcare spending. It used to be education. We're not the education state now. The state of Michigan government has become the government to pay for healthcare services. It's the single biggest expense. I'm talking about Medicaid and then healthcare for state employees and for other public employees. So fixing Michigan, making government flexible so we can do the things we need to do, requires state health reform. And what's missing in all the debate in Washington about health care reform? It's missing in our current state programs. It's missing in our federal programs. There's no requirement that the recipient help. And it turns out that 50%, maybe as much as 70%, according to an article I saw yesterday, of healthcare costs link to behavior. Government can't make you healthy by giving you a card. It's the great myth that we followed. And so we spend billions of dollars and we're not healthy. The key to making Michigan healthier, to freeing up those dollars, is to reforming our state health programs, much like Governor Engler did with welfare. You may remember, in 1991, Dale Sugars, you were probably there, Senator Sugars, he said, we will help you, welfare recipients, but you have to look for a job. And that's what's missing with our state health programs. We're helping people, we're giving them a card, but they're not required to do anything. So I have a business in my district that says, we're not going to hire you if you're a smoker. Now that's controversial. I'm not necessarily endorsing that, but they're doing it in the private sector. So I have people that quit smoking to get a job so they can pay taxes, to pay for my last patient's care. My last patient, I work Sunday, a 24-hour shift. My very last patient was a 17-year-old girl having a baby. I was called to do a labor epidural at 5 in the morning. I looked at her chart, and she's been smoking a pack a day during her pregnancy. And you're paying for it. And she's at a hospital where every room's a private room. Every room has color TV. It has valet parking. And I can give her the best anesthetic, the best medical care in the world. But if she's smoking a pack a day and has the baby 2 months early, and it goes to the NICU, it's going to cost another $500,000. So what we need to do, we need to fix these government programs to require the recipients to be participants in their care. And it's the same for state employees. I got a card. I sit on it. It's not linked to my behavior at all. So there's a great opportunity to put a Republican stamp on health care reform that says, yes, we'll help you, but we have to fix these government programs before we expand them further. By the way, the federal proposal, if it were passed, one of the federal solutions to solving Michigan's uninsured is to make the state, the federal solution is to make the states cover more with Medicaid. And the estimates are it would cost us another $800 million. So the federal solution is we got a plan to fix the uninsured. States expand Medicaid and cover more people. We can't afford it. We need a governor that will say no to the federal government making us spend more when instead we need to invest in things that will move Michigan forward. Spending more in health care has not made us more competitive. So that's the number one thing I would do if I was elected governor, and it ties to the health of your business, this huge expense on health care without getting a return. The second thing that you all need to think about, that we all need to think about, this is the year of reform. You know, we're facing a budget crisis. We don't have enough money to keep doing what we're doing. So what are we saying in Lansing? Well, we're going to reform things, change them, like Medicaid. But there's other room for reform. We would benefit from a part-time legislature. We could have more working legislators. I think that would be the good thing. We need tighter budgeting rules. We need to look at the role of local governments and our 551 school districts and our ISDs. Can we really afford all those things? Well, it turns out some of them, and maybe many of those, are embedded in our state constitution. It was written in the 1960s. We're on our fourth state constitution. It was written when we were a rich state, and it has these multiple layers of government. It has the full-time legislature. It has loose budgeting rules, which allowed the governor today to propose. She proposed her budget to the legislature. It's not balanced. It relies on $700 million in federal stimulus money, another round that has yet to be approved. So she's allowed to propose a budget that's not balanced. The Constitution says in the end it has to be balanced, but it doesn't require the governor or the House or the Senate separately to begin with balanced budgets. This is why you have these shutdowns. The House last year passed a budget that they wouldn't raise taxes, they wouldn't cut spending, so they passed an unbalanced budget. So having tighter budgeting rules would be very helpful, but that's a constitutional measure. So I've come to the conclusion that one of the tools, one of the ways to fix Michigan is going to be rewriting the state constitution. You know, your association, you're going to have to study this. You should have a committee to start thinking about it. It could happen. Even if you decide it's a bad idea, it could happen. It's on the ballot every 16 years. And this is the 48th year. And we've rewritten our Constitution about every 50 years. And I say it's time. It was written when we were a rich state. We can't afford the expense and the structure of government that was put in place then. And if we could rewrite it, by the way, the way it works is if the people approve a con, then there's a special election to elect delegates who meet separately. It's not the legislature that writes it. It's delegates, citizen delegates, who meet. They propose a constitution, then it comes back to the voters for approval. If we could do that, it could position Michigan for growth. We would be the first state since the mid-'80s to rewrite our state constitution. And it could be written for the age of the internet. There are many things that we could streamline in government to say that Michigan is open for business. So, you know, the next governor is going to have an opportunity to reform state programs, Medicaid, programs for state employees' health, but that alone will be insufficient. I believe we're going to need, and we have an opportunity to rewrite the Constitution that can also position Michigan for growth.